When this dentist was seeing patients, he encountered a strange patient. The patient claimed that something was moving inside his teeth, and that it was very painful. However, after a thorough examination, the doctor found nothing unusual. The only anomaly was the patient's dental x-ray, which showed a white shadow. However, the dentist did not find any other abnormalities. He prescribed some painkillers for the patient and asked him to return for a follow-up the next day. But as the male dentist was preparing to leave work, he noticed something in the sink. When he picked up the filter to inspect it, he was stunned by what he saw. Some long, bean sprout-like organisms were wriggling on the filter. Upon seeing these organisms, the doctor suddenly realized something. He immediately opened the patient's x-ray and examined it carefully, discovering a large group of thread-like organisms on the patient's gums. He rushed to the library to look up information, learning that these were parasites called dental worms. Once infected, they spread from the mouth throughout the body. Upon returning to the hospital, the doctor found the patient had arrived, and the condition seemed to have worsened. However, the doctor had never performed such a surgery before. He tapped on the glass, asking the nurse to put on goggles and gloves for protection, but the nurse thought it was just a routine surgery, telling him not to make a fuss. She gestured for him to come in immediately to assist. Reluctantly, the man put on a double mask and protective goggles, forcing himself to begin the surgery despite his unease. After administering the anesthetic, the man tried to ask if anyone else had been infected. The patient shook his head and said no. When the doctor asked again if he had been in contact with other infection sources, the man shook his head again. With no other choice, the doctor began the surgery, but when he picked up the scalpel and approached the patient, his hands trembled uncontrollably. After a brief pause, he forced himself to calm down and restart the surgery. As the scalpel cut through the skin, his hands trembled even more violently. Just as he was about to remove part of the toothworm, the doctor suddenly discovered a more serious issue. At that moment, the patient's body began to convulse violently, and an odd expression appeared on his face. Then, an accident occurred. Due to copyright issues, we will stop here. Interested readers can watch the original video.